Hi, my name is Shilpa Aggarwal. I'm an assistant professor of economics and public policy at the Indian School of Business. Today I'm going to talk to you about some of the research that I've done on the impacts of a large-scale rural road construction program here in India, the Pradhan Mantri Gram Sadak Yojana. So, why is understanding the impact of something like a rural road scheme important? So, just to give you some perspective, currently the World Bank alone has more than 2,500 active rural and interurban road construction projects. And together, these projects amount to more than $250 billion in commitments from the World Bank alone. So there are other multilateral agencies, other country governments, and together, if we look at the amount of resources that are being spent on the construction of roads, they amount to a significant fraction of the global GDP. And while so much money is being spent on these projects, it's not really known what is the impact of constructing roads on social or economic outcomes. It turns out that these roads had many positive effects. So, for instance, in the village economy, once these roads were built, then a lot of the goods that are imported into the village from the nearby towns, prices of these goods fell substantially. So they fell about 10%. And I measured impacts over a 10-year period from 2001 to 2010. So essentially what I find is that these price effects alone were the equivalent of 4 years of economic growth in these areas. So because prices are falling, so people's real incomes are increasing because of that. So the decrease in prices was the equivalent of 4 years of economic growth. I also find that the availability of goods goes up. And this is the availability of a certain kind of goods. So the first kind is goods which are produced in cities. So for instance, minor manufactured goods like electric bulbs or plastic toys or umbrellas. So the availability of these kind of goods goes up, which obviously is good that people have more varieties to choose from, more kinds of goods to buy from. The other kind of goods whose availability goes up are actually local goods that would typically be produced locally but were not being produced earlier because there wasn't enough of a market. So what do I mean by that? So take the example of milk. So of course, milk does not need to be brought in from the town. It is produced in the village. But earlier in a lot of villages, not enough milk was being produced because there wasn't enough demand from the local village, and it was not possible to access towns to sell this milk. But now once you build these roads, these milk chiller vans essentially could come in from the town to buy milk in the village. So villages started producing more milk and more was available even for local consumption. So these kind of perishable but highly nutritive goods like dairy, meat, fruits, vegetables, their production and consumption actually went up in the villages after roads were constructed. I also have some very intriguing results on schooling. What I find is that young kids, those between the ages of 5 and 14, they are actually more likely to be enrolled in school when you build roads. And this could be due to a whole host of reasons. It could be because it's now easier to get to school. It could be that a family is richer. It could also be that the teacher is more likely to be in school now that the road has been built. So I can't identify the exact reason, but 5 to 14-year-olds are more likely to be in school. 14 to 20-year-olds, on the other hand, are actually less likely to be enrolled in school. So these children, the adolescents, they actually drop out of school when you build roads. And why is that? It's because labor market opportunities improve. So they are actually less likely to be in school and more likely to be working. So this is sort of this unintended negative consequence of building roads. But related to this, I also find that the labor market participation of older women also increases. So women who are between the age groups of 25 and 40 are more likely to be working when you build roads. They're doing low skill work, so they're doing animal rearing, working in tailoring, agriculture, but they are more likely to be working. I also find other positive effects for women. They have better access to reproductive health services, so they're more likely to deliver in a facility, more likely to seek institutional antenatal care, more likely to be vaccinated. The kids are more likely to be vaccinated. So very, very difficult public health problems to solve, each of them on their own. Roads helped us make progress on all of these. We typically think that the market-based economic system is good and people can do well for themselves if they participate in the market-based economy. What's important to keep in mind is that for people to be able to participate in the market-based economy, they should be able to easily access markets, and the physical access to markets, which is facilitated by roads, is an important aspect of it. Thank you.